Hi, I'm Matthew Stamp, and I'm doing my policy paper on dry needling versus acupuncture in Virginia. Dry needling became an active practice for physical therapists in 2007 in the state of Virginia. It is considered an advanced procedure in which the therapist must complete a Federation of State Boards of Physical Therapists approved training course. Knowledge and skill of cognitive and psychomotor competencies must be demonstrated. In the state of Virginia, dry needling is an invasive procedure that requires referral that is written and specific. The PT shall not perform beyond the scope of practice. Informed consent must be obtained by the patient and maintained in the records. Only a PT can perform dry needling. An assistant or other support personnel are not allowed. The difference between dry needling and acupuncture: dry needling is a method used by physical therapists to work on trigger points known as knots, pain spots, muscle pain, or spasms. Many in the acupuncture field consider dry needling a type of ashi acupuncture, where the acupuncturist may place the needles on pain spots found upon palpation. There's also a kind of non-trigger point therapy where the PT may put the needle in an area where the patient says it hurts. Acupuncture, on the other hand, uses specific points on the body, on channels or meridians. These points have an effect on holistic aspect of the body to treat not only pain but can assist the body's ability to balance various systems in the body like skeletal, muscular, digestion, respiration, circulation, endocrine, and more. There are also specific points in the body called extraordinary points. While they may not be on meridians, they are specific points that do specific things. Lastly, there's Ashi acupuncture, which is basically essentially the same as dry needling. The acupuncturist works with the patient to identify areas and spots. This is just a graph showing the difference between dry needling and acupuncture. Please pause the video and have a look. Dry needling in Virginia. While many acupuncturists opposed the use of dry needling in the state of Virginia, it was a losing effort from the beginning. The Acupuncture Society of Virginia did raise their voice, and hundreds of acupuncturists voiced their opinion on a state-run petition opposing dry needling. However, in June of 2017, the Board of Physical Therapy's Regulatory Advisory Panel met discussing guidelines for dry needling. The panel consists of 8 members with only one representative of acupuncture. When it came to voting on the definition of dry needling and the regulatory, the votes were 7-1 in favor of dry needling, with opposing voice was that of the acupuncturist. The governor of Virginia eventually approved the proposed regulation in December 2017. The Acupuncture Society of Virginia reached out to council and requested a memorandum of what it would cost to have a lawsuit filed against the Board of Physical Therapy. However, the cost was 20 grand, with a negative prediction if the society would file a lawsuit against the Board of Physical Therapy. Dry needling in Virginia. One of the main problems of the Virginia legislature is that there is no clear definition as to what dry needling is. This may allow physical therapists to practice beyond the scope of just needling trigger points and incorporate acupuncture points. They might use electrostimulation and retention of needles. Another example is that the Board of Physical Therapists defines dry needling as using a filiform needle to penetrate the skin and or underlying tissue to effect change in the body structure and function for the evaluation and management of neuromuscular conditions, pain, movement impairments, and disabilities. The definition is almost the same for acupuncture, which is stimulation of certain points on or near the surface of the body by the insertion of needles to prevent or modify the perception of pain and to normalize physiological function, including pain control, for the treatment of certain ailments or conditions of the body. Lastly, the state regulation states that dry needling is not an entry-level skill, but an advanced procedure that requires additional training. This is vastly different from acupuncturists that must go to an accredited school, spend several years of didactic and clinic training, pass exams, and do national board examinations with the NCCAOM. Physical therapists have no agency program, standardized curriculum, nor a means to assess competency, and no examination process. Dry needling impact to the acupuncture industry. It is not clear what the impact dry needling is having on the acupuncture industry, other than that there's competition and the public may not be aware of the two differences. Will physical therapists steal a portion of our patients? Yes, but in my experience, I still have patients that come to me having tried dry needling and feel they get more benefit from acupuncture. They have expressed that dry needling was more painful and uncomfortable. The CPT current procedural terminology codes for dry needling are 20560, which is insertion of needle without injection into one or two muscles, and 20561 is insertion of needle without injection into three or more muscles. It is not clear how many times they can use these codes, and it is mentioned not to combine them with other PT codes, like manual therapy 97140. Acupuncture, on the other hand, uses a broader range of codes, and you can build up to 4 lines on claims. 97813 is for the first 15 minutes of acupuncture with E-stem. 97814 is an additional 15 minutes of acupuncture with E-stem. 97810 is first 15 minutes of acupuncture without E-stem, and 97811 is an additional 15 minutes of acupuncture without E-stem. Dry needling impact on practice, patient care, and reimbursement. The main concern for acupuncturists on dry needling is safety. The number of hours the dry needling physical therapist has in training can be done in weekend seminars as opposed to years of clinical training in an accredited school. The risk of needling into blood vessels, nerves, causing a pneumothorax or infection are main concerns. The American Academy of Physical Medicine and Rehabilitation states on dry needling is that they recognize dry needling as an invasive procedure using acupuncture needles that has an associated medical risk. The American Academy of Medical Acupuncture states any invasive procedure has associated and potentially serious medical risks and is safe only if performed by properly educated, trained, and experienced health professionals. They continue on to say, dry needling frequently involves needling of muscular structures that may be deep and or hidden under layers of other muscles and tissues and close to sensitive structures and organs, including blood vessels, nerves, and organs, for example, the lungs. Another major difference is that acupuncture serves a wider range of protocols, including stress, anxiety, insomnia, digestive issues, pregnancy, infertility, allergies, and a wide variety of pain issues, both mental and physical. Dry needling only addresses painful trigger points or myofascial pain. Dry needling seems to attract more sport athletes needing physical therapy. In searching for average cost, dry needling, I found that some sessions can be as high as $60 and some as low as $15. The average acupuncture session in Northern Virginia is about $80 to $100 a session. The future of dry needling versus acupuncture in the healthcare system and legislation. As mentioned prior, the Acupuncture Society wanted to take legal action against the Virginia Board of Physical Therapy. However, they were advised by counsel that would cost 20 grand, and it was predicted there would be no change in the current laws in place. What we can do, however, as acupuncturists is to inform our clients what the differences are between them, with emphasis of our 1,000 hours of training, safety, clean needle technique, areas of caution as to do no harm to the patient's blood vessels, nerves, internal organs, especially the lungs, in the case of pneumothorax incidents. Virginia faces challenges with its dry needling history. It is as if Virginia legislators allowed it to roll on through as law and ignored the dangers it may present to Virginians. There is significant amount of training an acupuncturist goes through with several regulatory boards like the NCCAOM, the Council of Colleges of Acupuncture, who regulates the clean needle techniques, the Virginia Board of Medicine, and requirements of graduating from an accredited college or university. While dry needling may give some relief to some trigger points or muscle spasms, its scope and range is not as great as acupuncture. I know 2 acupuncturists who did take the myofascial pain seminars in Bethesda, Maryland, and they stated to me that what they are doing and training at the seminars is not what is being taught at acupuncture schools, and they do teach extensive safety when needling. Rolling back Virginia law on dry needling may not be the answer. What might help is if dry needling courses are added to acupuncture schools so that acupuncturists may understand the methods, techniques, and trigger point theory from a physical therapist point of view, despite our understandings of Hugu and Ashi acupuncture. In the future, I hope acupuncturists and dry needling practitioners can have a more open dialogue to better understand each other's methods and practices.